All right, thank you all so much. So we are going to go ahead and get started because we have a lot to cover today. I am very thankful and grateful that there are so many people who are interested in this subject. I know this has been all over the news. We are happy to have some great expertise both within the food depository and within Protect Our Care Illinois to talk about these really important topics. We are going to be covering the budget reconciliation process. We'll talk about kind of where we're currently at. We will go over threats to Medicaid, threats to SNAP. We will cover immigration and the child tax credit briefly. And then we're going to end on a note of advocacy and what we can all be doing in order to fight back against these cuts to ensure that we are able to avoid cuts, to mitigate damage, and to make sure our voices are being heard as advocates. Ideally, we're going to be leaving time for a Q&A at the end, but the chat, as you can see, is open. We also have the Q&A box that is open. So as questions come up throughout, feel free to post the question in the chat. We'll have one of my colleagues kind of monitoring the chat. And if you have a question that you'd rather write in the Q&A, you can do that as well. So without further ado, we will go ahead and get started. So my name is Molly Dubow. I'm the manager of advocacy here at the Food Depository. I will let the other two speakers introduce themselves as their slides come up, but we are, as I mentioned, going to be discussing SNAP and Medicaid and what we can do as advocates to protect these life-saving programs. So we're going to start with discussing why these programs matter in the first place, right? I am confident that everybody on the webinar right now already understands why these programs are so vitally important, but it is still really helpful to have talking points and to be able to very succinctly explain to people why these programs are so crucial and why we are going to fight so hard to protect them. So in Illinois, for reasons why Medicaid matters, in Illinois, 1 in 6 adults aged 19 to 64 are utilizing Medicaid, and it covers them. 1 in 2 children, so that is a gigantic statistic. 2 in 3 nursing home residents, also a really gigantic number that people, I think, aren't totally connecting or realizing. 1 in 5 people with Medicare beneficiaries uses Medicaid as well. Oh, sorry, my computer zonked out at me for a second. 1 in 3 people with disabilities and 4 in 10 pregnancies are being covered by Medicaid. All of that together is about 3.4 million Illinoisans, a little under 3.5 mil, and over 772,000 adults are enrolled in Illinois because of the Affordable Care Act's Medicaid expansion, which we will talk about a little bit later. So on top of all of these statistics, Medicaid is the largest funder of long-term care services, which includes nursing homes and home and community-based services. So that's where you kind of see that 2 and 3 number for nursing home being covered by Medicaid. It is absolutely critical for rural hospitals, children's hospitals, and health centers. There are many rural hospitals that have already come out and said they will essentially have to close if these cuts to Medicaid happen. It is the largest funder of mental health and substance abuse treatment. And additionally, it also plays a key role in helping through pandemics and is the largest funder of HIV and AIDS services. So, just it being such a large medical service, it provides a lot of medical resources in times of emergency, such as pandemic, which we have all lived through together. So SNAP, on the other hand, equally important, right? These two programs really work hand in hand. SNAP matters really crucially for the work that the Food Depository does, that any food bank, any food pantry is working on. SNAP, which is, I'm sure all of you here know, formerly known as food stamps, is the primary source of nutrition assistance for almost 2 million people just in Illinois alone. It lifted almost 260 or 270,000 people above the poverty line just in Illinois, again, which includes over 130,000 children that's 2014 and 2018. So, these are, and I'll go into this in a future slide, these are numbers that are a little bit older and does not totally cover the increased need that we've been seeing these last few years. every dollar spent on SNAP generates $1.50 on average in economic activity. And that statistic and that research was done by USDA, and it particularly emphasized that this dollar generation, the economic generation, was more impactful during an economic downturn. So as the economy slopes downward, SNAP does even more to help boost the local economy. And the reason being that people have their cards, their EBT cards in their hand and able to go to their local store to make purchases. And then that store receives, economic support from their community. And then lastly, SNAP benefits help reduce the risk of diet-related diseases. There's a ton of research that has been proven truly that the more money people have on SNAP, the more nutritious and culturally relevant and all those choices that people are able to make for themselves and their family, rather than forcing restrictions on SNAP and not increasing the amount of money that people receive, just causes administrative barriers and confusion and is very expensive rather than it being something that actually improves health outcomes. So on the right-hand side, you can see here that 67+% of SNAP households include children, and 30+% of SNAP households have a disabled or senior family member. And the last thing I really want to emphasize on this slide is you can see a scale here. It represents, on the right, you have a box of food that, theoretically is picked up from a food pantry, food delivered by a food bank. And on the left, you have SNAP. For every one meal that is able to be provided by all the food banks and food pantries combined across this country, SNAP provides 9 meals. So that is a level of direct service that no matter what happens, the food banks and the food pantries will not be able to to fill that gap, will not be able to close the difference between what SNAP can provide and what food banks and charitable food system provides. So the reason that we also want to mention this slide here in terms of why SNAP matters is that many of you work at food pantries, many of you work at community-based organizations, and you recognize that levels of need are incredibly high right now. This is all, you can see this line, which is the $200,000, or dollars, excuse me, 200,000 household visits line as like a reference across the top. And we, throughout FY25, have, either touched or exceeded that every single month. These level of unprecedented, food insecurity and need in the community is what we are experiencing right now. And that is before any of the proposed cuts actually take place, right? So we are already at a point where the food banks and food pantries and the social safety net that does exist right now is barely able to keep up with what is currently happening. So that is where we want to ground in the reality of where we are at right now, being at a level that is incredibly unsustainable for ensuring everybody has the food that they need to thrive. And that is before any negative changes are made to these programs. Down to the next slide, perfect. So demand, and as I should emphasize too, that last slide was focused on food pantry visits, right? Demand at food pantries does not cover the whole picture of food insecurity. You can see that, or even through your work at community-based organizations, just from talking to people, maybe you yourself as you've SNAP in the past, there are many people who are food insecure that never come to food pantries. And when benefits are cut, more of those people will need to utilize our network. So that those numbers, will just increase. But as I mentioned earlier, SNAP is able to cover 9 meals for every 1 meal that a food bank or food pantry is able to give. There's just no amount of, even if we food banks received 9 times the amount of food or 9 times the amount of money, which we have not and are not, even if we did, the flexibility that SNAP provides to people is something that is not replicable across the charitable food system. So what we know is that there are policies that we can put into place that will mitigate the food insecurity issue, and that there are policies that we can do to help not only avoid the, what we're heading towards, but to make things better. We live in a very wealthy country, the wealthiest country in the world, the wealthiest time period to be living in a country like ours. Hunger in a country like ours, where we're doing right now, is a active policy choice that we are making in deciding, even though we know the policies that can be made and policies that can be changed to improve the situation for people, we know what would work, and we are actively, choosing not to do that. As of September 2024, 1 in 5 households overall and 1 in 4 households with children living in Chicago were experiencing food insecurity. That is a ridiculously high number that does not need to be experiencing food insecurity when we know exactly what we can do to help prevent it. This graph here, you can show, or you can see, I should say, the dip that we experienced as a country in child poverty rates and food insecurity rates. When the COVID pandemic happened, there was expansion in social safety net programs, and those made a very, very real impact on the level of food insecurity. And so by not only, going backwards and removing those expanded social safety nets, but now going backwards on what currently exists, we know we don't need to wait and see what happens. We know the data. We know that this is an active policy choice being made to allow hunger and levels of food insecurity and to go up, and for people to lose healthcare access. So that's just kind of a state of where we're at right now and why SNAP and Medicaid matter so much. So from now, I'm going to pass it over to my colleague Beth, who's going to go over a bit about the budget reconciliation process and kind of where we're at in that.
Thanks, Molly. So I'm Beth Kenefick. I'm a senior policy advisor at the Greater Chicago Food Depository. Molly set us up really well talking about why we care about these programs. I'm going to share a little bit about what specifically is happening, and then Nadine and I will go into the specific cuts that we're seeing because of why this is happening. So traditionally, the federal government has to pass a budget every year. It does this by its federal fiscal year on October 1st. But it often wants to make bigger and bolder and larger changes. And it does so often through a process called budget reconciliation. It's a little bit wonky, but you're going to see it a lot in the news because it's what's sort of setting up the situation right now. And the reason that Congress uses it primarily is because it means that bills are not subject to the filibuster in the Senate. So they're able to get through the Senate if they don't have sort of the 60 votes. In this situation, the reason that they are trying to go with budget reconciliation is because there are some expiration of some tax cuts that passed in past years that they want to extend. And that's not super popular because of the impact on the deficit. And to make those sort of big lasting changes over a long time horizon, they're going to use this process. It's a process that they have used for other things like the Affordable Care Act, the American Rescue Plan, but the big sort of goal and point is that it has to be budget neutral. So they're trying to pass changes to revenue, which are going to increase the deficit. And so at the same time, they're going to have to pass changes to spending. And that's why we're in this situation right now where we're looking at cuts to programs like SNAP and Medicaid. You also are probably wondering or probably have noticed that we've been emailing a lot over the last couple of months, and that's because there's multiple steps to this process, and we're trying to sort of pause and prevent as much harm as possible at each possible step. So earlier in this year, we saw Congress pass what's called budget resolutions and committee instructions. And so there wasn't a lot of detail in those, except that they said, we're going to do this. It's going to be about tax cuts, and these are the things with
Beth is having an internet problem. So I will go ahead and jump in. Oh, are you here?
Yes.
You pause, but let's just continue from the point of where we're at right now, this moment.
Sorry. So the committees have to write bills. What we saw in the last couple of weeks is that the House was doing what's called a markup and sort of sharing out what's in those bills, and then they voted on it. The Senate will have to do this process next, which we'll explain in a little bit. And then they have to reconcile differences. So even though stuff has happened recently, it's not over. There's still more that can change. Just sort of level setting what those instructions were, we were looking at sort of 4 specific House committees that have different jurisdictions over different programs that we care about, and then what their instructions were. So in the House Committee on Education and Workforce, that's where we would see our child nutrition programs, as well as higher education. We didn't actually see any cuts to child nutrition, but a ton of cuts to higher ed. On the far left, is the House Committee on Ways and Means. That is where all the tax policy stuff happens. And there are some changes to the child tax credit that we will mention. But this is where a lot of those tax extensions are happening. The 2 in the middle are the ones where we saw the SNAP and Medicaid cuts. So the House Committee on Agriculture put out stuff. They were instructed to $230 billion over 10 years. And then the House Committee on Energy and Commerce, which has jurisdiction over Medicaid, had the instruction to do $880 billion over 10 years. Both of those were just floors. They are fully welcome to go above and beyond. After those markups, they went through a number of processes that we don't need to fully go into.
Yeah, so Beth, it might help a little if you went off camera. Your computer signal is bad. I don't know why. Thank you. Perfect. So let's go to the next slide and see here. Okay, I will just quickly go over this one while Beth toggles with her internet a little bit. So the rationale behind the proposals. So we just wanted to quickly go over kind of the messaging that you may be hearing, looking at a big picture. So looking at the budget reconciliation process and what, the messaging we've been hearing and what the proposals mean from a big picture scale, the House version of the reconciliation bill that was approved by the House by 1 vote would add $5 trillion to the national debt over the next decade by cutting taxes and raising spending. Those additions to the deficit include a $1.1 trillion increase in tax cuts for people who make more than $500,000 a year, and simultaneously a $1.1 trillion cut in Medicaid and SNAP. So you can kind of see where the cuts are coming from in terms of what they're trying to balance. But even with the over $1 trillion in cuts to Medicaid and SNAP, it would still balloon the deficit. So this has been characterized as a significant transfer of wealth and economic security from the poorest people in the country to the wealthiest people in the country. This is not how the change is being messaged, right? Because if you just came out and said that, everybody would be very angry immediately. So we thought it would be helpful to give some specifics before we get into specifics to share the themes that will come up. So on the left, we've outlined some messages that are being used, and then on the right is kind of what it means in practice. So on the left, you see a lot shifting costs to states because states should pay their fair share, which is a way to avoid making true benefit cuts on the federal level. But what it does is creates an unsustainable cost for state budgets, which very, very likely will lead to SNAP and Medicaid cuts and reductions in benefits. You'll hear a ton about determining who is worthy of benefits, that people who are on it who aren't worthy. So it's limiting who is deemed eligible, which is ultimately targeting vulnerable groups such as older adults, immigrants, and people with disabilities, et cetera. And then you hear a lot reducing waste, fraud, and abuse, which they are using as a reason to increase barriers for eligibility to be able to benefit from these services. So with that, I'm going to pass this to Nadine at Protect Our Care Illinois to go over some Medicaid specifics.
Thank you so much, Molly and Beth. Hey, everybody, I'm Nadine Israel. I use she, her pronouns. I am the Senior Vice President of Policy and Advocacy at AIDS Foundation Chicago. I am also an AFC, is also a member of the Protect Our Care Illinois Coalition. And I'm here representing POCIL in this webinar. Thank you so much for having me. So before I get into these the specifics about what's in the budget reconciliation bill that the House passed last week specific to Medicaid, I just want to reemphasize the points that both Beth and Molly brought up as to like why the House Republicans and Senate Republicans and the Trump administration is even doing this in the first place, right? Their overall goal is to extend tax cuts for the ultra wealthy. Those tax cuts are going to cost a few $1 trillion. In order for them to do that, they need to have a way to pay for them. Their way to pay for them is by cutting healthcare, ACA, Medicaid, food, SNAP, and other benefits, other essential benefits and services from low and middle income people. So this is a really important reminder for all of us, because the messaging, as Molly shared, is going to look different. They're going to use different talking points and message it in different ways, but none of it is truth, because the truth is Medicaid and SNAP and other safety net programs need to be further invested in. We know they work. We know they save lives. We know they lift people out of poverty. We know they help people improve their well-being. And if anything, they should be talking about how we can improve and invest in these programs. Instead, they're talking about making billions, numbers that are beyond my comprehension in terms of cuts and funding cuts. Why? Because they need a way to pay for extending tax cuts for the ultra wealthy. Why? Because that's who they really care about at the end of the day. If they truly cared about the low income people, middle income people, really the 90% of us that are not the ultra wealthy, none of this would not even be a conversation that we would be having right now. So I just wanted to make sure that to kind of reemphasize this point, because it's really important as we continue our advocacy and our pushback to stop this from happening. So what's in this bill when it comes to Medicaid? What did the House pass when the budget reconciliation bill? There's a ton in there. It's over 1,000 pages that includes Medicaid, SNAP, et cetera. They passed it in less than 2 weeks from initial they dropped it to passage, which is insane. And now the US Senate is going to start the same process for their own version of that bill. But what's in the House bill when it comes to Medicaid? I'm going to do high level. So this is not everything. So broadly, creates conditions and changes to the federal medical assistance percentage, FMAP. FMAP is basically the deal that the federal government and states have in terms of who's going to pay for what and how much. So the FMAP is how much. Federal government, it's a deal, it's a contract that's been in existence, it's in federal law, it's in all the different contracts that they have with the states, but it's basically a percentage. So, and it varies. For different programs and services for people on Medicaid, that percentage varies. But generally speaking, that's what FMAP is. So what the bill does is it includes a 10% reduction in Medicaid expansion states that provide health coverage for undocumented immigrants through Medicaid or other state-based programs. So what does this mean? This is basically a punishment for states like Illinois who cover undocumented people with their own state dollars, not with federal dollars because that is not allowed, with their own state dollars, and who cover legal permanent residents, so people who are documented with Medicaid and other public health service programs, again, with their own state dollars. They are punishing those states for doing that by saying that if you continue to do that, we are going to reduce your FMAP for the Medicaid expansion population, which Molly said was 772,000 people in Illinois, by 10%. 10%, just to give you a sense, is for Illinois, it's going to be roughly a couple $2 billion a year that we would lose if this were to happen. Obviously, something that the state is not going to be able to raise just like that, or find a couple $1 billion in order to not make this cut happen. So really, the idea here is to punish states that are covering undocumented folks, even folks with legal permanent residence, so documented folks with their own state dollars under Medicaid. This second one is prohibits federal reimbursement for applicants while waiting to verify citizenship or immigration status during reasonable opportunity periods. This was basically saying that while somebody, it takes time to apply and get the benefit. So during that time that you're waiting, the federal government and the state government would pay for the services that you needed. This is saying the federal government isn't going to do that anymore while in this period of time where folks are verifying their citizenship or other immigration status. Next slide, please. This other kind of broad category institutes conditions of participation. So what does this mean? This is one of the most important points in terms of the Medicaid cuts that are in this bill that are going to hit hard for a lot of people on Medicaid if this happens, if this bill becomes law. It establishes a work requirement for adults ages 19 to 64. At least 80 hours of work, community service, participation work, or educational program, or a combination of activities. Y'all are in the, a lot of folks on this webinar are in the SNAP world. You're familiar with work requirements for some people in SNAP because that's already part of the policy. Medicaid has never had a work requirement. Illinois Medicaid certainly has never had a work requirement. And there's a reason for that because work requirements don't work. Work requirements are really job loss penalties. That's all they are. What does that mean? Well, let's say you have a job, you lose your job. Well, now you're going to lose your Medicaid too if this bill becomes law. Because what this is saying is that you have to be engaged and prove that you are engaged in work regularly to keep your Medicaid. We know from the experiments that Georgia and Arkansas did when it comes to work requirement in Medicaid is that most people who qualified for the work requirement, they met the work requirement, they met Medicaid eligibility. Most of them still fell off of the Medicaid program and had a hard time coming back on, not because they weren't eligible again, but because of the red tape, the administrative barriers that a work requirement presents. And again, if we remember the overall goal of what they're trying to do, this makes sense. Their goal isn't to increase engagement in work or education. Their goal is for people to drop off the program so that money is saved so that they can extend the tax cuts for the rich. That's it. The other piece in this one is require states to implement cost sharing. So they want people in or near poverty, who are the people that qualify for Medicaid, low-income people, to have cost sharing, so like a copay, when it comes to using some Medicaid benefits. Again, we are talking about people with very little income, in poverty or near poverty. Next slide, please. Okay, so this category is about implementing new and enhanced eligibility standards. Now, this might seem like, okay, not that bad. However, again, this is more red tape. So right now in Medicaid, you have to go through a redetermination or renewal process every 12 months. In this bill, it's saying, no, we should do that every 6 months in Medicaid. Again, we know that every time folks have to engage in any kind of administrative work with the state to keep their Medicaid benefit, they're going to drop off. A lot of folks will drop off. And so again, that's their goal for increasing the eligibility. It has nothing to do with waste, fraud, and abuse. The other piece to this is that, or another bullet point in this broad category is they want to restrict retroactive eligibility from 3 months to 1 month. Basically, if you were on Medicaid, once you applied, the provider would be able to bill for the last 3 months of services that you used because they know it takes time for you to get on Medicaid once you apply. What this is saying is no, that retroactive period is going to be 1 month instead of 3 months. Again, they're trying to save money to provide tax cuts for the ultra wealthy, ripping away healthcare and food from low income and middle income people in order to give more money to people who don't need it. Next slide, please. Okay, this category is, or this slide and the next one are about other additional Medicaid cuts are in this bill in addition to cuts that impact the Affordable Care Act, because those are in there as well. So for Medicaid and the Affordable Care Act, this bill, the House Budget Reconciliation Bill, prohibits coverage of gender-affirming care for adults and for young people. And we know this is really, really important. This is not like a side benefit. This is critical to folks feeling like themselves and presenting like themselves in the world, and it improves mental health. We know it's part of somebody's identity, and this coverage is critical, just like coverage for heart disease or cancer or HIV is. It prohibits Planned Parenthood from being a Medicaid provider for a 10-year period, even for services that are not abortion related, right? Because abortion services were never allowed to be covered by Medicaid dollars. So lots of folks use Planned Parenthood, especially in rural areas, in order to get their basic healthcare needs, women and men for that matter. And what this bill says is that Planned Parenthood cannot be a Medicaid biller for the next 10 years, again, if this bill were to become law. It instituted cost sharing. I mentioned this a little bit. Up to $35 per service. There's some exemptions to that, but again, exemptions are really difficult to implement properly, and a lot of people fall through the cracks because even when they have an exemption. Budget neutrality. So it looks at if you might be familiar with the 1115 Medicaid waiver that the state has right now, that is trying to do some creative things with housing, with food, with work supports. There's language in this bill that say, let's take another look at those kinds of waivers. And again, with the idea that they want to claw back what they can in terms of money and approvals. Codifies harmful rules that prohibit DACA, so deferred action immigrants from shopping the marketplace and receiving premium tax credits. Next slide, please. A couple of other things. So it makes it harder for people. So now thinking about folks on the ACA in particular, on the Affordable Care Act marketplace, it makes it harder for people to enroll in that coverage because it bars automatic re-enrollment. It imposes arbitrary premium penalties, limits the annual enrollment period even more, restricts the special enrollment period that were put in, so job loss, if you get pregnant, if you move, etc., if you graduate from school, imposes new verification requirements beyond that would essentially all of this would be burdensome for consumers and the marketplaces, by the way, to implement. It also bars lawfully present immigrants like refugees, survivors of trafficking, domestic violence, and other serious crimes from enrolling in the ACA marketplace coverage. Next slide, please. And now I think I'm turning it over to either Molly or Beth.
Yes, thank you so much, Nadine. I'm going to pass it off to Beth. That was a really thorough and wonderful overview of Medicaid. Thank you so much. So Beth is going to cover some of the changes being made or proposals being changed for SNAP and going over similarly to Nadine. Go ahead.
Thanks, Molly. I am back with better and more stable internet. Although now it's saying it's unstable because that's how it goes. I just wanted to say if people are horrified by all of the things that Nadine just said, as a reminder, one, it's not final yet. It's not over. There's still fight that we can do. Two, the benefits have not currently changed to people on it. So that we want to make sure we're not inciting panic of folks that are currently on Medicaid and SNAP. And there are social media and advocacy stuff that we will get to at the end to support that. Now, in terms of SNAP, as we mentioned, you're going to see very similar themes to the ones that we were seeing with Medicaid. The first is the state cost requirement. So analogous to sort of what was talked about with FMAP. But unlike Medicaid, SNAP was always 100% federally funded, at least for the benefits. States only had to provide a portion around administrative funds. So they are changing what is happening around the actual benefits. And they're saying that every state is going to have to cover at least 5%. And that they're going to incentivize states to improve what are called payment error rates by having larger cost shares if you fall into higher payment error rates, which is where I say, one, that a payment error rate is not a measure of fraud. The USDA is perfectly clear about this. It is a way that they calculate sort of over and under payments. And so there's a tolerance level, currently $57. And so if you accidentally pay someone over or under within that $57, you don't get a payment error rate. And those are things like you calculated your income wrong because you don't have a very consistent income. You made a deduction incorrectly. So this is, again, not fraud. And I should also mention that they are changing how payment error rates are calculated and making them even more difficult. So they're lowering that tolerance from $57 to $0. So that's all set up to say that payment error rates across states are going to probably increase, and they are basing cost shifting on these payment error rates. Right now, Illinois' error rate is 9.91%. It has varied from 1% to I think 11% in its history over the last 20 years. But at this 9.91%, we would be asked to pay 20% of our SNAP benefits. So starting in 2028, we would be asked to pay $888 million. On top of that is the changes to the current administrative costs, going from a 50% match to a 75-25%. And so that would be approximately an additional $83 million, give or take, based on what years you're using to calculate. So we could see Illinois in total being asked to have an extra $1 billion just to cover SNAP. And that's on top of what Nadine was saying around SNAP and Medicaid. Now, we don't fully know what happens if a state can't make that $888 million. There are folks that have sort of best and worst case scenarios, of which I won't fully get into. And honestly, they're a little scary. But we know that right now, states can't really cut benefits and eligibility. And so they would have to sort of claw back different administrative changes that they've done to make the program run better. And so this is to this point of sort of not cutting benefits in the actual package, but then shifting the choice to make those cuts to the state. So it's the state's fault for doing this change. Next slide. The other change that we're seeing is they're sort of freezing how benefits are calculated. And so again, in this theme of trying not to sort of impact current levels of benefits, we were rumored that there would be changes to the current thrifty food plan calculation. They didn't do that because you would see sort of an immediate change to everyone. Instead, they're saying you can't really change the thrifty food plan moving forward. You can't adjust it for nutrition standards, food purchasing patterns, all these other things that we've adjusted it in the past to try to keep up. And this change would impact everyone on SNAP in Illinois, of which, as we've noted at the top, is around 2 million residents, or 16.2% of the population. So this is where we can say every sort of person in Illinois on SNAP is impacted by this freeze. The thrifty food plan I'll mention also is used to calculate summer EBT. Illinois had 1.2 million children on summer EBT last year, as well as TFAP and a couple of other programs. So in the future, we'll continue to see changes. This is also analogous to a lot of the stuff that's happening in Medicaid. It goes to this theme of sort of redefining who's considered worthy and who should be receiving these benefits. SNAP already does not allow undocumented folks on SNAP, but there are a number of legally present immigrants that could receive it. In Illinois, that was around 63,000 folks that fall into different categories, and they're sort of changing that back. There were some this is the only thing in which we saw a change from when the original thing was introduced and what was passed, and that there were some changes around Cuban nationals and them still being able to receive SNAP. There was also a number of changes to work requirements, of which, similar to what Nadine said, work requirements don't work. We have a ton of research that this does not actually decrease the need for SNAP. It just decreases participation in the program because folks can't meet the time limit, they can't meet the barriers, but they're still hungry. There's still food insecurity. They're just not getting connected to the program that they need. And they're doing this in two ways. They're changing who's on sort of general work requirements by expanding the age. And by doing that, then there are more folks that are considered sort of, in part, have to do with the time limit. So right now, if you don't meet the work requirement over 3 months, you can be kicked off of SNAP. They're also increasing the number of folks who are impacted by those time limits by changing what's considered a dependent. So right now, you're exempted from those time limits and work requirements if you have a child under the age of 18. They've dropped that down to a child under the age of 7, saying that because the child has gone to school, that parents and others should be working. This was probably the biggest thing we saw in the House markup, where people talked about children, what happens during the summer, what happens if a child is disabled, what happens out of school time. We know that work and school don't always line up in terms of hours, and there was no conversation about what happens to leaving a 7-year-old home alone. Right now, there's about a quarter of the Illinois SNAP caseload are in households that have an adult that would be newly subject to these time limits. And so about a quarter of the households on SNAP a quarter of people on SNAP in Illinois would potentially see their household benefits decrease if that adult does not meet the work requirement. They're also changing the ability for states to sort of respond to things like recession. So Illinois has had a high unemployment rate for many years, and based on the pandemic and other things. And so we've actually had a statewide waiver where people are not currently subject to those time limits. That waiver runs through January 31st, 2026, but we will not be able to apply for future waivers like this. Only at the county level, only if those counties are at 10%. And that's just not something that our state or really any other state would meet those qualifications. And so there wouldn't be a way to sort of pause and reflect and say, hey, there aren't jobs for people right now. And so they should still be able to access food while there aren't jobs. And then there's a number of other proposals. They eliminate the entire SNAP nutrition education program. They're narrowing how utilities and internet costs are calculated, all things that were done to make the program more administratively easy for people. But they're not trying to make it more easy, they're making it harder. They want people to fall off, and then they use those savings to pay for the tax cuts. We have a full analysis if you're like, wow, this seemed really great, and I want to learn more and read in more depth in partnership with other advocates around the country, as well as folks within Illinois. We've done our best to sort of outline what we're seeing and what could be the potential impact in Illinois. And so there's more information, and feel free to share with networks, your delegation, your members, etc.
Thank you so much, Beth. I know that's a lot of information. I just posted our more thorough analysis in the chat. We will also send a follow-up email with our analysis and other resources that we mentioned in this slide deck in this presentation. But feel free, as always, to write your questions, comment, etc. There is a lot going on. There's also, as Beth and Nadine both mentioned, like there's a lot more still to happen, a lot more that we can do as advocates to continue to push and to fight and to say, we are not okay with this. We stand together as one Illinois and to protect our neighbors, our families, ourselves, everybody from this devastation that is being proposed, right? It's been proposed, but it's not been enacted. And regardless of what happens, like we know we all stand together very strong in our advocacy, and we make sure that we always continue the fight, right? There's always fight left to be had. And we'll get into some specifics of how the food depository has been doing that, and POCIL has been doing that. But in the meantime, I'm going to cover just one more element kind of that we've touched on briefly in this House reconciliation bill that passed, which is immigration and child tax credit. So as we've discussed, this reconciliation proposal guts our safety net. It increases risks that Americans face because they can't afford healthcare and food, but it also, very explicitly enacts significant harm for our immigrant communities and our immigrant neighbors. This bill supercharges the deportation and detention complex in the U.S., which massively increases funding for the border wall and immigration enforcement. It would strip safety net benefits for immigrants, targeting states using state dollars to fund healthcare for immigration. As Nadine mentioned, Illinois uses our own state dollars to help support our immigrant communities, and it's targeting states like ours using not even federal money. And this bill would remove benefits from previously eligible immigrants, such as asylees and refugees. So that is a very, significant change. While doing all of that, this bill also includes an increase of $51 billion for the border wall and $45 billion for the Immigration Customs Enforcement, ICE, which is 13 times its current annual budget. This bill also includes $27 billion specifically for agents. So an increase in all of these things while also cutting the billions of dollars in Medicaid for the 14 states, such as Illinois, that cover immigrants with our own tax dollars, and cuts benefits for, as mentioned, for those that are currently eligible for programs. It's also always worth mentioning that our undocumented neighbors pay taxes and are not eligible for any of these programs already, due to their undocumented status, but they are paying taxes. So to be targeting so many people who already we should have been supporting is a level of it's an extra layer to all of this, right? Addition to the immigration policies, there is a targeting in the child tax credit for children of immigrants. So 4.5 million children of immigrants, regardless of whether their parents had Social Security numbers, were eligible for the child tax credit as long as their parents met income eligibility and filed taxes. Because again, people can file taxes without a Social Security number. The 2017 previous Trump administration Tax Cuts and Jobs Act denied the child tax credit to children who they themselves did not have a Social Security number, which resulted in 1 million children losing access to the child tax credit and almost 32,000 in Illinois. This bill would go further by denying the child tax credit if one or more of their parents filing taxes uses an ITIN number, which is the tax filing number for undocumented immigrants, even if the child themselves has a Social Security number, which would strip the child tax credit from 4.5 million additional children, including almost 200,000 in Illinois. So again, it's just kind of a tripling down on the targeting of immigrant communities of an extremely vulnerable population and a population that already was barred from so many services that they could have benefited from. So what comes next? We, as Beth, very helpfully mentioned early on, we are kind of in a complicated long-term process between the House and the Senate in terms of budget reconciliation. The House has already gone through all of its steps and has voted on and very, very, very narrowly passed its bill. So the Senate is currently writing its own version of the bill. Senate leaders have already said they're not going to start with the House version. They are writing their own. So right now, we expect that the mega Senate bill could hit the floor as early as the week of June 9th or sometime in the 3-day stretch leading up to Juneteenth, which is a federal holiday. The Senate Majority Leader, John Thune, has not commented on a specific week beyond wanting it through the Senate by the July 4th recess. So he wants it through the whole process, actually, not just the Senate, by the July 4th recess, which is admittedly very ambitious on their end, but it just kind of shows you the level of zeal they have to make this happen. There is a complicated process called the Byrd Rule, which there are certain things included in the House budget that would not be allowed to be included in the Senate, that GOP staffers on the Senate side are currently trying to figure out what would be allowed and what not be allowed due to that rule. They will not be announcing their kind of proposal and doing a bunch of markups the way the House did. So we're expecting multiple closed door strategy sessions next week once the lawmakers return from holiday recess, and for them to kind of just announce this is the bill without necessarily doing all the markup that the House did. Okay, next slide. Okay, so we have talked a lot about the bill specifics and what has been proposed and what has been passed by the House, right? And the fact that the Senate is working on doing something similar. There is a lot more that we all as advocates can still constantly be doing to beat the drum in terms of how important it is that these cuts and these changes do not happen. We have a few different tools that we can or we are going to be sharing here in the chat as well as in a follow-up email. The Food Depository has made 6 or 7 different graphics kind of highlighting the different ways that SNAP impacts the state, the country, communities, families, etc., including things about, economic impact, things that people are maybe not always thinking about, and retailers that are supported through SNAP. So you'll be able to find the social media toolkit in a follow-up email. I don't have the link ready for right now, but I can post. We also have a campaign for the action alert for protecting SNAP and Medicaid. We are currently targeting senators to be able to hear from us on why it's so important that we protect SNAP and Medicaid. Our senators and most every Democratic senator is likely to vote no, but it is important to continue to make as much noise as possible and to give our members of Congress the talking points and the ammunition that they need to make sure that they are fighting against these cuts to the absolute best of their ability. So I am going to, okay, perfect. So I'm going to switch to the next slide, if we can go ahead and do that. So the next thing that we are working on here is the I Benefit from SNAP storytelling webpage. This is a new initiative that the Food Depository is working on that we are hoping to collect stories from individuals who use SNAP, from community organizations who serve people who use SNAP, from local retailers that accept SNAP, from local growers, farmers, small farmers that or benefit from SNAP existing. And we want to be able to collect as many stories as possible to be able to share with our members of Congress to continue to give them that ammunition that they need to be able to, hit the floor, hit the TV interviews, to make as much noise as possible and to fight back against the, untruths, the myths, the falsehoods, the lies about these programs. I think there are a lot of legislators who, even if they're, against the cuts to SNAP and Medicaid, don't necessarily know the entire universe in the ways in which these programs benefit their constituents and the economy and, local communities. So the more stories we can get on this, the better. We posted the link right here in the chat. Again, it will get posted or it will get sent in the follow-up email. But this is just a really great opportunity to I encourage you to do it yourselves. I encourage you to tell your neighbors, to tell your staff, your fellow staff members, your community, your friends, your family, your local farmers. There's so many ways in which SNAP benefits all of us. Perfect. And then I'm going to pass it to Nadine to share specifics for Medicaid action.
Thank you so much, Molly. And if you're like me, even though I do this every day, I talk about this almost every day, your blood may be boiling right now at the atrocity and cruelness that is in this budget reconciliation bill. And to the point that both Molly and Beth brought up, there is still a lot of advocacy that we can do to stop this thing and mitigate the harm. And right now, our attention turns to the U.S. Senate. So through Protect Our Care, Illinois, some of the advocacy resources that I want to make sure I shared are, we do a phone bank every Friday at noon. So the link is there. I'll drop it in the chat in a second. That you can join from anywhere. It's super easy. And it's all basically laid out for you. Even if you've never phone banked before, I had only phone banked like 1 or 2 times before, and I found it like super easy to plug in, and a good experience overall. So please, if you have 30 minutes, you have 15 minutes, if you have an hour, jump on Fridays at noon, and there's a registration link. We're also collecting stories. So to the point about stories, even as you sit here, all these numbers are hitting all of us all the time in terms of the bad that is being proposed. There's only so much in our brain that can hold that amount of information. But stories, faces, and human impact, we don't forget. This is why it's so important. This is why we're also doing the story collection on the Medicaid side, because we need to make lawmakers who are voting for these cuts face the people that they're going to cut benefits for, and look and hear their stories and force them to hear the stories. That's why these stories are going to be not just important for this current time period, but they're going to be important even a few months from now and a few years from now as we continue our advocacy, regardless of where this fight is at. And then I also included another action alert that's specific to Medicaid that we at AFC have. So I'll drop the links in a second. Next slide, please.
Okay, perfect. Thank you all so much. I think Beth, Nadine, and I feel as though we just managed this in record time. So there's a few minutes left. I've seen some questions pop up in the chat here, so please go ahead and keep posting those and post some in the Q&A if that's more comfortable for you. Somebody asked about the Byrd rule, so I just want to verbally share. The Byrd rule is a rule in the US Senate that restricts the type of provisions that can be included in a budget reconciliation bill. So the reason that the House included so many things in budget reconciliation that maybe seem not budget related is because in order to get a law made through Congress, you have to be able to, in the Senate, have a filibuster-proof majority, which is 60 votes. The Republicans have a majority, but they do not have 60 votes. So most of their legislation that they do that is, objectively like something that is not bipartisan and across the aisle wouldn't sign on to it, won't go anywhere legislatively. The caveat is that the Senate is allowed to pass something called budget reconciliation with a simple majority. And that is why this is such a gigantic, that's part of why this is such a gigantic bill. The House included a lot of things, but because this is budget reconciliation, there is a rule in the Senate that whatever provisions end up in the final bill has to actually be budgetary first, right? It can't just be something unrelated to budget. And so that is why there's going to be some change. That is one of the reasons, like, there will be some changes made to the Senate bill. And so that's a nonpartisan group called the Parliamentarian is reading through the bill and kind of marking anything that doesn't pass that rule of being budgetary. I hope that helps a little bit.
Yeah, Mala, and the other question someone asked was, is this related to the one big beautiful bill? Yes. What the package ended up being called that the House passed was HR 1, House Resolution 1, one big beautiful bill act. And that's where those different committees sort of put out text. It got put together into one thing. And so we were sharing the specifics around SNAP and Medicaid that were included in that.
Perfect. Okay, sorry, so many great comments here, so I'm sifting through to find questions. Okay. Is it useful to call or email our senators more than once with similar content in terms of Medicaid and SNAP? Yes. So our action alert is, I specifically made it so that even if you do it once, you can keep doing it, which I don't do for all of our action alert emails. So the same is true for calling. You can call every day and talk about this issue. You can email every day and talk about this issue. Ultimately, we live in a state where our two senators are very, very, very more than likely to vote no on whatever the Senate writes, right? But the important part is knowing how many people are continuing to call and email to make this point, right? So even if it's 30 seconds and you have the time every day and you want to just keep calling and saying, hey, I'm continuing to call and say that this is, you don't have to say vote no. If the staffer is willing and comfortable to say, oh, they're definitely voting no, you can just start calling and saying, I want to just continue to voice my opinion on this and make sure that senators Duckworth and Durbin are doing everything they can to help prevent this from happening. So there's never a reason to stop calling ever. We'll continue to make our voice heard. Nadine, you have anything else in there?
Just really quick, if you're calling and you also have a story, you can share your story experience with when you call. So call, voice your opinion, and also share it. Say, hey, I have a story. This is my story. This is what happened. This is what happens to my neighbor. This is what happened to my family member. Those offices are going to be very interested in getting those direct stories as well.
Okay, we're right at time. Thank you all so much for your time and your questions today. I am posting my email right here in the chat should you have additional questions. And so I will, follow up if you have questions. I will also be sending a follow-up email, so you can just reply to that if that is easier. Thank you all so much. This was a really great conversation. Thank you to Nadine, thank you to Beth, and keep up the good fight. We've got a lot left in us, right? The fight continues, and we will continue to advocate forever. Thank you all.
Thank you.